Hi, my name is Dr. Andrew Greller, and I'm a board-certified veterinary ophthalmologist here with South Texas Veterinary Ophthalmology, located within the beautiful San Antonio Veterinary Specialists Hospital. You're here today to learn about what cataracts are and how we can treat them, and ultimately, what's the best course of action for your pet. Obviously, things can be kind of complicated. Your pet may be older, they may have other health issues such as diabetes or a heart murmur, and they may be very old. And so one of the concerns you might have is regarding anesthesia. We're going to walk through all the other health issues that your pets have to make sure that you make the most informed decision and the right decision. Ultimately, if we feel the surgery is too risky for your pet or it's not the right decision, we will let you know. So what needs to happen? First of all, you should convince your veterinarian to refer you to an ophthalmologist for an examination. After speaking with hundreds of veterinarians over the course of my career, I have learned that most general veterinarians, number one, feel that they don't have the experience, know-how, and training in ophthalmology as it relates to cataracts, or it's been so long since they went to veterinary school that they've sort of forgotten what was taught to them. Two, they don't have the equipment to properly examine the eye at a high level. And finally, they may not have any idea as to whether or not you, as an owner, feel comfortable or are really truly interested in having cataract surgery for your pet. So if you're interested in learning more, ask your veterinarian for a referral for an examination. When you arrive at South Texas Veterinary Ophthalmology, the first thing you're going to see is a beautiful, clean, first-class veterinary hospital. More impressive are the people and the doctors that are here within the hospital itself. My colleagues, Dr. Darden and Dr. Fritz, along with myself, will help you make the most informed and best decision for your pet. The technician is going to come find you and your pet, welcome you into our exam room, and we're going to do a full ocular examination. First, we're going to take a patient thorough history, and then we're going to perform some diagnostic testing such as the Schirmer tear test and check your pet's intraocular pressure. So what is a cataract? A cataract is a cloudiness or opacity within the lens itself. And since the lens is such a vital structure within the eye for allowing for acute vision, when that lens is cloudy, your pet's vision is blurred. If your pet truly has a cataract, that means that the ophthalmologist will have a hard time seeing the back of the eye, most importantly, the retina. And since a pet won't sit there and read the eye chart and tell us what they can see, nor can they do a visual fields assessment, we have to do some very specific tests for your pet in order to determine whether or not they're a good candidate for surgery. The two tests that we do are called an electroretinogram and an ocular ultrasound. An electroretinogram, think of it as an electrocardiogram of the eye. We're checking the electrical function of the retina when light is stimulating the retinal cells. In an ocular ultrasound, we use a high-definition probe and put it on the eye and image all the structures within the eye. Now, if the retinal function is really good, meaning that they don't have the human equivalent of macular degeneration, and all the structures within the eye are functional, meaning the retina is not detached, then typically your pet is going to be a good candidate for surgery. However, it's also important that we check your pet's most recent lab work. If they're not diabetic, typically we want to make sure that lab work has been done within about 90 days of surgery. If their lab work looks good, we should be good to go for surgery. Now, if they're a diabetic patient, we want to make sure that their diabetes is fairly well regulated. None of the patients we see typically are perfectly regulated, and rarely are they very well regulated. The important thing to keep in mind is that if they are fairly well regulated, we should come in for an examination first. We shouldn't wait until they're perfectly regulated because oftentimes the cataract will progress to the point where there's severe inflammation inside the eye. We may miss our window for surgical intervention and hence may not be a good candidate at that time if we wait too long. So what happens after the examination? So after we've done our examination, our retinal testing, and reviewed the most recent lab work, we're going to start your pet on topical medical therapy. Why are we doing that? Well, your pet's eye pressure may be off a little bit, or your pet may have low tear production. We want to make sure that we prevent inflammation, address any pressure issues with the eye, and stimulate tear production if needed. But ultimately, we want to keep the eye as healthy as possible from the time they have the retinal testing until the time when they have surgery. It also gives you the opportunity to get used to and in the routine of applying eye drops. If you cannot apply eye drops, or your pet is so uncooperative that it's going to be impossible to do so, then it's probably not in your best interest to consider surgery. We want to make sure that you get the routine down prior to doing surgery as to maximize a great outcome. We typically recommend that you schedule cataract surgery within about a month of doing the retinal testing itself. Once we've finished the examination with your pet, we've discussed the benefits and risks. We'll typically answer questions you have regarding costs. Just know that ahead of your appointment, you're more than welcome anytime to give us a call and ask us for an estimate. We'll typically give you estimates of the initial examination, the pre-testing itself, and the surgery, whether or not we do one eye, both eyes, lens replacement. Typically, our cost quoted will also include 3 months of post-operative visits. If you decided to move forward with surgery, we will help you schedule it. Typically, we don't want the patients having anything to eat or drink after 10 o'clock the night before. In the case that they're diabetic, however, we do want them to have their normal food and insulin the morning of surgery. Typically, we'll have you come by and drop off your pet between 7:30 and 8 the morning of surgery, unless, of course, we've made arrangements if you're driving from hours away. There are several pet-friendly hotels around the hospital, so feel free, if you're staying overnight, to consult our website for more information. When you come in for the drop-off, the technician will meet you in the lobby and review the paperwork. They'll make sure that you've signed the consent forms for anesthesia, and then they'll admit your pet to the hospital. Once your pet has been admitted, the doctors will make sure that they do a physical, thorough examination and will ensure that your pet is comfortable within our patient suites. Once we're ready for surgery, we do need to do general anesthesia, so your pet will be monitored extremely closely by a qualified crew of veterinary technicians. We will place an IV catheter, we will induce anesthesia, and your pet will be intubated and monitored very closely using state-of-the-art monitoring equipment. Once we've done that, we will clip the hair around the eyes if they have long hair and use an antiseptic solution to prevent infection at the time of surgery. We will then bring your pet gently into our world-class operating suite where they lie on their back on a warmed, soft operating table with intravenous fluid support. And again, all the high-tech monitoring equipment. We'll go ahead, we'll get the surgery started, and we'll remove the cataract. We may or may not recommend lens replacement depending on the risks and patient factors. If we decided to do both eyes, we'll go ahead and we'll have the other eye performed, typically at the same time. With cataract surgery, we emulsify that cloudy lens and remove it from the eye and implant a new clear foldable lens. Like I said, sometimes lens implantation is not possible or is not recommended if we feel it's too risky to the patient. Once we're done with surgery, we're going to recover your pet and monitor their progress very closely in our recovery suites. Our technician will stay with your pet at all times during the recovery phase, also making sure we're keeping the eyes lubricated and comfortable. Ideally, your pet will spend that evening with us in the hospital with our overnight nurses. Typically, it's just one night, going home the next day at a scheduled pickup time that works well for you. The morning after surgery, the ophthalmology surgeon will examine your pet to make sure that everything looks good with the surgery, that the eye pressure is doing well, and that we don't have any corneal ulcers or other potential complications that can develop postoperatively. When you come in for your discharge appointment, we will spend probably 20 to 30 more minutes with you, reviewing what the medications are and how often they will be applied, and help you schedule the postoperative recheck visits. We will also send you home with an organized spreadsheet with a list of all medications to help keep you on track and simplify the process. For the first 2 weeks after surgery, your pet must have strict rest and restriction in activity. That means no running, no jumping, no playing, no tussling with other dogs, no doggy daycare, and no grooming. We want them to rest and relax at home and wear an e-collar 24 hours a day for the first 2 weeks postoperatively. If your dog has difficulty eating with a cone on, we will give you some instructions and encouragement as to how to get them through this issue. Do not allow any rubbing of the eyes. Now, we'll typically examine your pet very frequently after surgery. The first recheck is 1 week after cataract surgery, followed by examinations at 1 month, 2 months, and 3 months postoperatively. The medications that are dispensed topically are typically 4 different medications. Those are antibiotics, anti-inflammatories, glaucoma-preventing drops, and artificial tears. If we're doing medication 4 times a day, we typically say to do them when you have breakfast, when you eat lunch, dinner, and finally before you go to bed. They don't need to be spaced out at any more specific time than that. All medications are to be applied 5 minutes apart. After the first 2 weeks, the medications are brought down to 3 times a day for the next 2 weeks. So that's breakfast, lunch, and dinner. Weeks 5 and 6, the medications are down to twice a day, breakfast and dinner. Weeks 7 and 8, typically down to once a day. And weeks 9 through 13, the medications are typically every other day. Now, if your pet has any long-term ocular health issues like chronic inflammation, an increase in eye pressure, or we have dry eye, we may need to do drops long-term. We might also recommend drops be extended for another few months, or in the case that your pet has glaucoma or dry eye, we might recommend drops forever, just like you would do for your own eye condition. Potential complications include those related to the anesthesia itself. Ocular complications can include glaucoma, which is an increase in pressure within your pet's eye, retinal detachment, which can lead to blindness, corneal ulcers, infections, and the worst case scenarios being blindness and pain, although rare. Other complications can include local irritation from the topical medications that we apply. Oral medications could cause an upset stomach in your pet. We will advise you what to look for to try and reduce the risk of those complications. Long term, we recommend ophthalmic examinations for your pets every 6 months to ensure that their vision remains as clear as possible. Well, we hope this video was informative for you. For any further questions regarding what other eye conditions we can help your pet with, please contact us at stvopets.com. Thank you.